This video will aim to teach you just a little something about radioisotopes. The focus will be especially the radioisotope iodine-131. Iodine-131 gives off beta radiation or beta particles. Beta particles are important to the successful use of radiation on patients. This is because protons and electrons travel at a high speed. These particles can restructure molecules in the body. If a person has been exposed to beta particles for too long, then the excess use of radiation can cause acute or chronic illness. Iodine-131 is a form of nuclear energy and is used for medical purposes. This isotope can be used to treat thyroid cancer and hypothyroidism. Iodine-131 is also used for diagnostic scanning. A radiologist will be able to treat these conditions. Iodine-131 is the most efficient isotope for use in medicine because it has a very short half-life of 8 days. Iodine-131 is used to treat thyroid cancer. When the isotope is injected into the body, the radiation targets the affected area. The radiation destroys all the tissue that is affected by cancer. This will kill all the damaged cells in and around the thyroid. Iodine-131 is also used to treat disease called hypothyroidism or overactive thyroid. This is when the thyroid gland releases too much of the hormone called thyroxine. A patient is treated for this with iodine-131 in a tablet form. The patient will swallow the tablet and the radiation will absorb into the body and target the affected area. The last medical issue that iodine-131 is used for is diagnostic imaging. The iodine is injected, swallowed, or inhaled. The patient then sits for 30 minutes so the iodine is accumulated throughout the body. When the patient is put inside the MRI machine, the affected areas will come up onto the computer. This can indicate to the doctor the problem with the patient. Benefits of using iodine-131 treatment are all the cancer will be destroyed in the thyroid so the patient will be cancer-free. If the patient had an overactive thyroid, then after the treatment, the thyroid will function as normal again. The iodine-131 will destroy all the damaged thyroid tissue even if the thyroid has not been taken out. With benefits, there are risks that come with the treatment. There could be side effects such as fatigue, nausea, and sore throat. If a patient is pregnant, they are strongly advised not to have this treatment as the radiation could harm the fetus. If a patient is having the treatment to treat overactive thyroid, then the patient's thyroid could stop working altogether. The benefits of using iodine-131 can outweigh the risks, as most patients who undergo this treatment become cancer-free. The function of your thyroid can go back to normal if your thyroid is overactive. All these benefits can outweigh the risks. Thank you.